coming up as the main theory of what could be happening during psychedelic events and afterwards. That is having these potentially positive benefits, but could be negative consequences as well. So we'll be talking about critical periods and reopening those critical periods with psychedelic medicines. So what is a critical period in general? So during specific periods of brain development, the nervous system exhibits heightened sensitivity to ethologically relevant stimuli, so natural stimulus in a species or an individual's environment, as well as increased malleability for synaptic circuit and behavioral modifications. Proper experiences during these periods are crucial for normal development. Okay, so this comes out of Dr. Gould Dolan's paper. And kind of an easier way to digest the critical period is this window of time where you're really, really sensitive to the environment around you. And what you learn during that time period kind of becomes locked in for the lifetime. It's a really strong period of learning and sensitivity to your environment. And another way to put this is a childlike state of learning, which is why when you go to a snowboard hill and you see a kid going down, or to the bouldering gym and a kid just beating you or learning music or language faster, it's because they have these open critical period and these kind of sponge-like minds. Okay, so what are some examples of critical periods in humans? So one is the language development period. So that generally happens from birth to around 7 years old. The other is the visual or optic cortex critical period, which can happen around birth to 5 years old. There's auditory, it's birth to 5 years old. Motor, birth to around 2 years old. And then sensory, which could include taste, smell, and touch, birth to around 2 years. And then one we're going to focus on more is this emotional or social critical development period, which is what her paper focused on in a little bit more detail. And so, always from a One Health perspective, where do we see these critical periods in animals? You can think of the dog socialization period in that puppy stage, maybe 3 to 14 week window. Bird imprinting, which is it can be, I've heard it from 14 hours to 48 hours. And this is actually really important. If everyone remembers the geese imprinting with Konrad Lorenz, that's actually where the term critical period was developed or came from, when he worked with geese to make them imprint on him instead of, or his plane that he used to help them fly. And so that's a kind of a cool topic that we see in birds. And another one with birds is the song learning, which can be from birth to 1 year old. We also have the cat visual development as an example, about birth to 5 weeks old, cat socialization, 2 to 7 weeks. And then they also bring up an example of horse weaning. I think weaning in general, that independent stage when they're trying to break away from the mother and have their own independence. We also can categorize that as a critical period of development. So what are the mechanisms of critical period closing? Because critical periods do close at a certain point. And there's a good question of why do they close in the beginning? Wouldn't it be great if our critical periods were open all the time and we could keep on learning and learning? Well, that actually is kind of similar to being maybe in a psychedelic state forever and ever. And that's not something that we always want. That closing down helps us to take what we've learned and move forward with it and not be overwhelmed. There's actually a theory that autism could be a form of extended critical period open or a failure of those critical periods to actually close. So I think that's quite fascinating. And so what are some of the mechanisms that are out there? And these are theories of mechanisms. This includes metaplasticity. We're going to define this a little bit more when we compare it with hyperplasticity. This inhibitory excitatory balance, the cells are it seems more in an excitatory phase when the critical periods are open, and then go to an inhibitory stage when they start to close. And then this extracellular matrix kind of hardening, which we'll discuss a little bit further. And that's kind of one of the theories that Dr. Dolan's lab is working with. So that actually downstream from a psychedelic event, we have the serotonin receptor activation or other receptor activation, which then downstream leads to this kind of melting of this hardened extracellular matrix, which allows for this critical period reopening. So the closing is this kind of hardening. We talked about this paraffin layer as closing over our cells, and that closes this learning mechanism down. Okay. So what about reopening critical periods? And some of Dr. Dolan's work is looking for this kind of master key of reopening critical periods. And so what is this? This might involve interventions that can restore the brain's ability to undergo significant changes in adaptations. So some recent research in neuroscience has identified several factors and methods that may help in reopening or extending these critical periods. And well, because there are different claims out there that different either things like antidepressants or stimulated environments, social interactions, these things I have listed before can open critical periods, but I think you would be careful out there. There's a lot of I think vocabulary being used where opening critical periods, but they're actually meaning just a heightened rate of plasticity. And I think for many years, at least in the psychedelic community, we've been thinking that those are the same thing. That psychedelics cause this increased plasticity and neuroplasticity, and that's all that's going on. But in the next slide, we'll talk why there's kind of a growing movement away from that and needing to describe this metaplasticity. So the psychedelics are potentially having this true reopening or true reactivation, where there's this melting of the extracellular matrix and actually reopening critical periods. Okay, so this is the paper that I had posted as one to read. Very good paper. Dr. Dolan's lab out of Johns Hopkins University is really changing the way we're having this conversation within the psychedelic community. So of all the papers out there, this is one to really focus on. And kind of in summary, in the animals that were treated with MDMA, they were able to learn that association just like they were a teenager again. So we returned them, this being mice in this specific study, to their teenage levels of learning after we gave them MDMA. Okay, and so one of the biggest takeaways, essentially, what we're finding from this paper is that various psychedelics can reopen these critical periods. And what they were looking at is social critical periods. And so what they were working with, ketamine, psilocybin, MDMA, LSD, ibogaine. And what's interesting, these are all working on very different receptors. They're having very different effects. And you might think, oh, MDMA alone and commonly very social psychedelic medicine, maybe not so much the other ones, but they weren't seeing that it was MDMA specifically that was causing this increase in social reward. It was this master key that any of these psychedelics were working, and maybe in the same pattern or in different ways, to reopen critical periods in general. And then it's the environment or the kind of setting like we talked about that the animal might be in. And so they've done it in both octopus and mice, that they exhibited more social behavior when given that opportunity. Okay. And what's very important about this specific slide is the potential duration of that critical period being open. Again, this is mice. We don't know how yet it translates to humans. Could be the general rule of what they're saying here. The longer the trip, the longer the critical period can be open. And so ketamine, being a very short trip, opens it up, but it can be closed in a number of hours or, well, weeks here. And then in psilocybin, this is about 2 weeks. MDMA, 2 weeks. LSD can be 3 weeks. And ibogaine, which is or iboga, is at least 4 weeks because they stopped measuring at that point. And so it could be actually much longer. And so what is this difference between hyperplasticity versus metaplasticity? So moving from thinking everything causes neuroplasticity. And that's where a lot of the money and focus has gone to in psychedelics, right? It's not very specific. Because if we think about plasticity, well, there's a lot of things that can cause plasticity or even hyperplasticity. Alcohol, cocaine, which they've also looked at in these studies, cause hyperplasticity and actually could be part of the reward system or a part of the addiction. So that's not what we're really looking for, or that's not what we're thinking is happening in psychedelics, where something different could be happening. And this is what they describe as metaplasticity. So they summarized as the ability to cause plasticity. So essentially, not just causing these branches and this kind of plasticity of neurons in the synapse, but metaplasticity is allowing the individual or the nervous system to become more plastic itself. So, in general, what's happening? Having a psychedelic event, this is leading to that extracellular matrix kind of melting or reopening, which is in turn leading to a metaplastic state within that individual, which is allowing them to, I'm going to say, control, but be able to cause more of a plastic states within their own nervous system. Okay, so a couple more interesting comments here. So it turned out when we tried all the other psychedelics we had in our pocket, like LSD and ketamine and ibogaine and psilocybin, they all open this critical period as well. Even though they don't have these pro-social properties, that was our first clue that it wasn't about the social. It was about the opening of critical periods, and that what generalizes across psychedelics is the ability to reopen a critical period. Okay, and so if we're right about that, then it might be the case that just by changing the context, we can reopen a different critical period. So if we want to reopen a social critical period, we give a social context. But if we want to change it to, say, a motor critical period or visual critical period, then we give a motor or visual context. So this is really important, I think, and that this is context dependent. It's not like we can give a certain drug and that this is going to happen, or this specific critical period is going to open, or this specific critical period is open. They could all potentially open, and it depends on the situation or the setting that that individual might be in that is causing that actual change. So the context or example that Dr. Dolan often gives is, just because you take MDMA and go to a rave doesn't mean you're necessarily going to have you might have pro-social properties, but that if you're working with a social trauma, anything else, then that might not actually be the therapeutic method that's going to help you. But take that instead in MDMA and going into a group ceremony or into a specific social therapeutic structured event, then that could reopen that critical period and help that to be more malleable. Okay, so where else are we finding this to be interesting? Because we think of social context, and I think there is, even just that alone, a lot for us to talk about in veterinary medicine. We're talking about animals who maybe didn't get proper socialization. Is this a chance where we could reopen those and use training methods or other behavioral techniques, and they're going to be much more responsive to it because we're reopening that social critical period. But like I said, there's other critical periods, right? Visual, auditory, all those other things. Are there other ways that reopening critical period could be beneficial both for humans and animals? So for this example, the critical period for motor learning, just like other critical periods, closes as you get older, but it reopens for about 2 months after right after you have a stroke, as the brain is trying to adapt to its new situation. Then it closes again. So if you don't get the right kind of physical therapy within 2 months after having a stroke, the extra physical therapy isn't really going to give you much more improvement after that. And so if you want to learn more about that, and they have the Fathom project for the Dolan Lab, which is really focusing on this. And so how incredible is this potentially for people who've either had some kind of delay throughout that physical therapy window of 2 months and couldn't get the proper physical therapy? Or what if you reach that 2 months, critical periods are reclosing? What's the only way to reopen it would be either to have another stroke, which would not be ideal, or potentially psychedelics that could reopen those critical periods and then allow physical therapy to be much more successful again. And so their lab is currently fundraising to do that kind of research, right? It's still just a theory at this point, but pretty fascinating. So it's not just social critical periods, it's all of them. And they're actually doing studies on frequent ketamine dosage and reopening the visual cortex as well. So potentially in congenital blindness or other situations, this is something that is very exciting that they're starting to look at. This is quite an old article, but I think we're all pretty familiar with puppies having a socialization period. And if they are taken away from that social period, then there's negative consequences. And so just some thoughts in general, how could reopening critical periods, and I'm not saying with psychedelics necessarily, but other different ways to reopen those critical periods, could it enhance socialization in older animals where they didn't have that proper socialization, improve training outcomes? So, if it's an enhanced plasticity in general, or just improving their ability to learn new behaviors and commands, maybe not the top one that we talk about, but an interesting possibility. And then for us, addressing trauma and anxiety, so interventions that promote neuroplasticity or reopening critical period could help animals recover from trauma and anxiety by facilitating new positive associations and behavior. And then what we also need to talk about, what about with accidental exposure? Well, now we have this knowledge that it could be 2 weeks, it could be even longer, that this critical period is opening. And as we kind of mentioned in the beginning, this critical period could be positive opening, right? Or it could be negative. So what I mean by that, if that period is open and you're bringing in positive enforcement, new training, wonderful. If that period is open and not great things are occurring in that period, that could actually be quite detrimental to that animal, theoretically. And so I think this is probably the biggest thing of why, or takeaway from this presentation, even with accidental exposure, we could be dealing or going into a space that we're not even aware of and might need weeks or months of follow-up. So the clinical trials have been hyper-focused on the trip itself, but we need to be paying more attention to what happens after the trip, because that's the window of time when learning is happening. So kind of just a summary of what I said, and why that's important to us in either accidental or intentional ingestion, that there's more we have to understand. Main discussion question. So where in veterinary medicine could reopening critical periods be potentially beneficial? So something for us to ponder this evening.